In tonight's Health Watch, there's another way that coronavirus could affect your health without you ever being infected.
Believe it or not, the disease could lead to shortages of important, even life-saving drugs. CBS 2's Dr. Max Gomez tells us how a virus in China could lead to shortages of drugs here in the U.S.
That's right, and it's about the raw materials that go into those drugs. Many of the raw materials that go into the drugs that we take here in the States actually come from China. The raw materials aren't contaminated with coronavirus. It's the production facilities and shipments from China that have been locked down. Most of the medications that so many of us take to relieve pain, reduce symptoms, treat and even cure diseases are mostly made in the U.S., but not the raw materials that go into these drugs. For both prescription and over-the-counter drugs, about 13% of the active ingredients actually come from China. But just as disrupting is that China is also the source of the so-called inactive ingredients in drugs.
80% of the other ingredients, antimicrobials that go into the active pharmaceutical ingredients, those are also made in China. So that puts the entire supply chain at risk.
Mike Alkire is the president of Premier Inc., a leading healthcare improvement company that has been tracking drug manufacturing issues. He said so far the FDA says they've been notified of a shortage of just one drug related to corona disruption, which they did not name. But the agency said it is working to mitigate that shortage. The FDA has contacted 180 manufacturers of human drugs to check on their supply chain and identified 20 drugs that solely source ingredients from China. So the potential for shortages is large across many drug classes.
We're worried about penicillin. We're worried about cancer drugs. We're worried about blood thinners.
Alkire also said that most of the companies they track keep about a 4-month supply of raw materials on hand, so they're okay for now. But if the corona supply chain disruptions continue much longer, there could be shortages. One solution:
we've got to look for other countries that can produce this product so we're just not so dependent on one country.
Now, manufacturers have understandably turned to the lowest cost suppliers for the raw materials, and that's often been China. But with these sorts of potential problems coming from China, we need to find some different countries. Now, the FDA also says, though, that it could safely lengthen the expiration dates somewhat on some medications, but that is clearly a stopgap measure. We're okay for now. But if this keeps going on for a while and the shutdown on shipment and the production facilities continues, we could see some shortages.
Something to watch. Doctor, thank you.